Okay, so the white matter pathways, of course, we'll look for these four out here: corticospinal tract, spinal thalamic tract, and here we just see the ventral spinal cerebellar tract. And the four posterior columns here, and remember this would be only fasciculus gracilis, because fasciculus cuneatus doesn't come in until we get above T6. So everything that we've pointed to in every section, spinal cord, brainstem, we tried to tell you this is what it does, this is what it does. And so you know that fasciculus gracilis has to do with vibration, proprioception, same sign, same sign. So if we asked you if you have a lesion here, you would know that the vibration, proprioception deficits would be same sign. Okay, so we have here a dorsal nerve root coming in, and remember that this information may ascend for a few segments in Litzauer's tract, and then we have a synapse here for the pain and temperature pathways in substantia gelatinosa. And remember, this nucleus continues all the way up into the lower pons, except in the midbrain, in the brainstem, we call this the spinal trigeminal tract. But it's the same nucleus. Here it just has to do with pain and temperature for the face. Okay, and of course our lower motor neurons are located in here in the ventral horn. So any lesion here, the patient would exhibit lower motor neuron findings. And with every test, you always need to know upper versus lower motor neuron findings. Lower motor neuron findings, of course, are atrophy, fasciculations, loss of reflexes, a floppy weakness, as opposed to upper motor neuron findings, which are spastic weakness, brisk reflexes, an extensor plantar response, clonus. So the night and day difference, but here are the lower motor neurons. And then we have the ventral spinal commissure, where we have the crossing pain and temperature pathways right here. Okay, certainly there are other pathways. I made a big deal about this part of the spinal cord just because we're just trying to stick with